Hi, my name is Ajinkya and I work as a Senior Program Manager at PTC, where I manage the Training Partner Program across South Rim and India. I'm here to talk about how PTC's IoT offering can facilitate and help improve efficiency in hip and knee surgery. Now, for a surgeon to monitor and predict the survival of an implant, it's important for him to know the status of two artificial components that goes as an implant within the human body. These are: 1. The position of metallic strip with respect to the ground, because it is expected that this metallic strip has to be perpendicular to the hip, knee and ankle axis. And second is the percentage of polyethylene available, which is nothing but ultra high density plastic. Current conventional X-ray techniques do not highlight these details and thereby makes it very difficult for a surgeon to make amends. Without appropriate amends, it is difficult to fine-tune bone cuts and achieve ligament balance for alignment. Moreover, as of today, there is no ways for a surgeon to get information regarding the replaced prosthesis. The bigger challenge is if the failure is detected late, it causes a lot of damage to the native bones, making any subsequent revision surgery almost impossible. A smart IoT-enabled sensor placed over the trial and the final component can provide immediate feedback during the surgery and also during the patient's follow-up stages. During this video, you will see how through PTC's Internet of Things offering, which is ThingWorks, we can develop a sensor which can provide valuable information to the surgeon, which will help him prevent discomfort to millions of patients who undergo the surgery worldwide every year. And eventually, it will also help us to improve the implant success. At a time of a surgery, a surgeon can place an IoT-enabled sensor between the two artificial components, which is the metallic strip and the plastic component. Now, these self-powered sensors are driven by nanofabrication technology and get charged through human motion such as respiration, blood flow, physical activities like walking, hand movement, etc. Now, for a surgeon, it is important to monitor few parameters in the medical field in order to know whether the status is right or wrong. Likewise, in knee surgery, parameters like metallic strip angle, percentage of polyethylene available and the impact of pressure are very important for the surgeon to know whether the implant is in the right position or not. And these parameters can be configured as thing shapes on the sensors. Data from the sensors through connectivity agent will get transferred to the PTC ThingWorks Composer, where using the data mashup it can be presented in a systematic and more personalized way. The Cassandra database can be used to save huge pool of information, and PTC cloud infrastructure can be used to manage the personalized data of every patient, so that if in near future a doctor wants to refer to the historic data of any patient, he can very well do so. Functionalities like the blogs and the wikis can also help the doctor to collaborate on certain complex cases and get information in a very quick time from around the world. During post-op, through the sensor data, a surgeon can effectively study the impact of different body activities on the implant and thereby, if required, take immediate corrective measures. Now, these corrective measures could be in the form of proper medication or suggesting of physiotherapy exercise or even by the usage of injectables. Thus, a resurgery can be avoided. Reports suggest that the medical device market has gone up by 6.1% in 2013 and is estimated to reach around $44 billion by 2018. According to the AHRQ study, it is estimated that by 2030, 11 million Americans will be having either hip or at least one knee surgery done, making it one of the nation's most elective surgical procedure. Coming to costing, on an average, the cost depends on case to case and complexity, but on an average, the range of such a surgery in US ranges from $16,000 to $44,000 plus the cost of physiotherapy. Sensors that are currently used in the field of medicine ranges from $150 to $200. Now, even if we use the best quality of IMD sensors and configure it on the ThingWorks platform, which obviously will require some man-month of effort, the end amortized cost coming to PTC will be close to around $200 to $250. Now, on a conservative side, even if we have about 20 to 25% margin on that, the end price that the patient would be paying for these sensors will continue to remain less than 1% of the total cost of the surgery. This means we are looking to address a huge market through these sensors. The companies that are manufacturing hip and knee replacement prostheses will be more than happy to adopt this technology. That's because it will help them to create key differentiation for themselves in the market and add a lot of value to their product. Now these are companies like Zimmer and Stryker in the US, Max in India, Smith & Nephew in the UK. Now let us see what a visiting surgeon at New York University Hospital for Joint Diseases and who has performed more than 600 surgeries around the world has to say about this sensor idea.
Knee replacement surgeons face challenges during surgery where positioning of components is important, or during follow-ups where the only tools available to assess progress are X-rays and clinical examination. Proper alignment is one of the requisites of a good knee replacement. However, conventional techniques using manually operated jigs do not provide accurate information regarding final positioning. The only way to know this is by getting X-rays after surgery, by which time the surgeon does not have any opportunity to make amends. In this regard, a smart sensor placed over the trial and final components can provide immediate feedback during surgery to enable the surgeon to fine-tune bone cuts and ligament balancing to achieve optimal alignment. After surgery, most surgeons would be very interested in getting feedback regarding what is the status of the implanted prosthesis. As of today, there is no mechanism by which we surgeons can get this data. And that is why a medical implantable sensor, which has already been proven safe, will be of utmost importance. Human body motions such as walking and hand movements can generate around 30 watts, which is good enough to keep these sensors charged. Now the activity pattern for each patient is different, and it is important to have a mechanism that can give patient-wise real-time information at different stages of recovery. These self-powered smart sensors can throw up an alert when there are factors which can affect the prosthesis. Sensors can also provide valuable information regarding wear of the polyethylene components and help the surgeon take necessary steps before the onset of severe symptoms like pain, swelling, difficulty in walking, which would prevent a lot of discomfort to the patient. Thus, this is something that we all will be looking forward to. I wish PTC and Ajinkya all the very best, and I really hope we can make this concept a reality.
Thereby, I conclude saying that we at PTC through our ThingWorks platform can help improve quality of life of millions of implant recipients worldwide. I would like to invite each one of you to come and explore this idea with us, wherein we make the promise of smart connected implants a reality for all our customers. Thank you.